Hi, I'm Tony Lova, and I'm a nurse here at Wilson State College nursing program, and I am doing my inserting and taking out the NG tube today for my skills. I'm going to start by checking my doctor's orders and my patient to make sure I have everything in order. And so I'm going to start off here. It is Shirley Cole. She's a 54-year-old female. Her date of birth is 5/14/1964. She was admitted to med-surg on the 14th for a small bowel obstruction. She has an NPO diet. She had an ultrasound of the abdomen at bedside ordered, an insertion of an NGT for gastric decompression, and a 2B X-ray of abdomen after the NGT insertion. And then we're going to attach NGT to low intermittent suction. So I'm going to make sure I have all of my products, or not my products, but all of my stuff that I need to do NGT insertion. And so I have all my stuff, a couple glasses of water, ice water, and we got all this stuff, syringe for the gastric checking of the contents. And I checked everything on the orders, and I have all my stuff to do it with. So then I'm going to enter my patient's room. Hi Shirley, I'm Tony and I'll be your nurse today. Can I get your name and date of birth? Shirley Coast, 5/14/1964. Perfect, thank you. I'm here to put an NGT tube in for you with the doctor's orders. And how are you feeling today? Not so good? Okay. Where's your pain at? About a 7 on a 1 to 10 scale? You about a 7? Okay, perfect. When was your last bowel movement, Shirley? 2 days ago. Got it. Perfect. Anything else going on this morning? And do you have any, you take any anticoagulants? No? Okay. Do you have any polyps in your nose that you know of? No? Good. Okay, perfect. So first I'm going to put the bedside down. And then I want to check your nares, okay, Shirley? Just making sure we want to check a side to make sure that you're breathing okay. Can you breathe for me? Breathe in. Breathe in. Which side do you prefer? Which one works better? The right side? Perfect. Perfect. Okay, so what I'm going to do next is I'm going to come back here and I'm going to check and grab my NGT tube. And we're going to measure our NGT tube to make sure we get in the correct position, and I have my Sharpie. So first we're going to start off. We're going to measure from nose to earlobe and earlobe to the xiphoid process. Okay, so we have it right here. Mark that. Okay, and then I'm going to check your bowel sounds today, okay, Shirley? We measured your NGT tube, and make sure to check your bowel sounds. Okay, we got hypoactive bowel sounds in all 4 quadrants. Okay, and then I'm going to do my hand hygiene, and I'm going to don some gloves. Now I need to come on the other side and grab some gloves. I put up my bedside rail. Come back over. Okay. And then I'm going to put a towel over you, okay, Shirley? Just to make sure I protect your gown from anything that might happen, any stuff that might come out or anything like that. And then I'm going to give you a glass of ice water, okay? Make sure you're comfortable. And I give her a Kleenex as well. And then I'm also going to give you this little kidney basin here to, just in case you need to cough or anything, so you have it right there for you, okay? Put that right there for you, okay? And then I would need to grab my lube and open it up. There we go. And then I would grab this. And for video purposes, I'm not doing this, but we would dip the NG tube in 3 to 4 inches and make sure it's plenty lubed up for our patient. Okay. NGT tube, got it. All right, so Shirley, on the count of 3, we're going to, actually I'm gonna take your pillow out from behind your head first, okay? Set that right here. And I'm gonna have you tilt your head back, okay, Shirley? Just a little bit. Thank you. Okay. So on the count of 3, we're gonna insert the NG tube on your right side. Okay. This is all for gastric decompression because of your small bowel obstruction. So on the count of 3, we're gonna insert the tube. 1, 2, 3. And then she started choking, and so we pulled it back a little bit, about 1/8 of an inch, and then we would use our pen light and our tongue blade to check for any coiling in the back of the throat. And Shirley, if you could just cough a couple times for me. Good, good. And so what I'm gonna have her do is Shirley, I'm gonna have you take a sip of water. Perfect. And then I'm going to have you tilt your head forward just a little bit, and we're gonna continue, okay? And each time I'm gonna have you swallow your water for me, okay? 1, 2, 3. Swallow, 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 swallow. Perfect. And we're at our insertion point, and then I'm going to wipe her nose. Just so that we can make sure that we attach it. Okay. And make sure to let it dry. And then we're going to take this strip off. And we're going to attach it to the nose. Making sure not to let it go so it doesn't slip out of place. Okay, got that. Okay, I'm going to remove the kidney basin. Shirley, I'm going to give you your pillow back, okay? And before I would have started, I would actually moved her to the semi-Fowler's, or she's in the semi-Fowler's position, and I would have moved her to a high Fowler's position. And then I'm going to remove the towel. Okay. Okay. And then what we're going to do next is we're going to, and then before putting this in, I would actually close this off to make sure that no gastric contents would have come in. I would have also made sure my suction was on as well, because we're going to be doing low intermittent suction. And so at this point, I would open this up, and I'm going to grab my syringe, and we're going to check for gastric contents. This is our first check to make sure it's in place. And so insert, and then we pull out gastric contents and make sure that we got good color. Close this back up. And then we would insert this into the cup. And we grab our litmus paper and our scale to check. All right, dip it in there and we check it. And it looks like it's at about a 4, which is perfect because it needs to be between 1 and 4 for us to do our NGT tube. And it looks like our first check is there. And then I have my tape, and we're gonna connect your tube to your gown, okay, Shirley? Perfect. And then we would connect this to the suction, the low intermittent suction. And then Shirley, we would go out. I would make sure that my patient has everything she needs. She has her call light, and I pull up my bedside rail as well. Is there anything else that you need? No? Good. Okay. And then I'm going to leave you with your ice water. I would take off my gloves, and then I'm going to document my procedure of everything. I'm going to make sure I have how the procedure went, how the patient tolerated it. I'm going to make sure that the color and consistency of the gastric fluid is good, and that would be it. And I'm going to make sure that this would be tossed into the biohazard container, and that would be it for that. And then I would be done inserting the NG tube, and I would leave the room after I had documented everything. And now I'm going to remove my NGT tube, and I'm going to make sure I have all of my procedures or all of my products to do this with. And then my doctor's orders for removal. And then I'm just going to make sure that the doctor's orders, we have Shirley Coe, she's a 54-year-old female, 5/14/1964, and we're going to detach the NGT from low intermittent suction and remove the NGT tube today. So it would be the next day probably that would happen. All right, and so I enter my patient's room. Hi Shirley, I'm Tony, and I'll be your nurse today. Provide patient privacy always. And so I would shut the door. And the doctor's ordered a removal of your NGT tube today. Good, you're feeling good. Good, I'm glad to hear that. Good. So we're gonna remove your NGT tube today, okay? And so we're gonna shut off suction, and we're going to make sure that we put this back here so that none of the gastric contents comes out. I'm gonna put a towel here to protect you. Okay, perfect, perfect. And then I'm gonna put her up into the high Fowler's position to make sure that she doesn't choke on anything. All right, Shirley, so we have everything we need. We got water for afterwards, and we'd have a washcloth, and I'm gonna have my gauze here as well. So first I'm gonna detach you from your gown, okay? And you're already detached from suction. Okay, and I'm going to put this here, and I'm going to take this off your nose. Okay, Shirley? All right, we got that right there. And then we would make sure that we'd clean the patient's nose with a cleanser of some sort to get the sticky parts off. And then, Shirley, on the count of 3, I'm going to have you hold your breath, okay? And then we're going to go ahead and remove your tube, and it'll be all done, all out, okay? All right, 1, 2, 3, hold your breath, out quick. We cover it up and dispose of this into the biohazard container immediately. Shirley, are you feeling okay? Good, okay, I'm gonna check your bowel sounds again. I would have checked bowel sounds as well beforehand, but we're gonna check her bowel sounds and see where they are. Perfect, we have active bowel sounds. All right, and then I'd clean my patient's nose on the inside as well as the outside with either a washcloth or just a wet wipe or Kleenex. And then I'm gonna offer my patient some ice water. If she is not NPO anymore, she'd get some ice water and a warm washcloth. I would make sure that she has her call light and that everything, she would be comfortable before I left the room. And then I'm gonna take my gloves off. Toss those in the garbage. And then I would document my procedure, and I'm gonna actually, with the suction, I would make sure to grab the suction container, and I would check the contents of it, the color, the consistency, and make sure I document all of that as well, and then I dispose of that in the biohazard container as well. So documentation at the very end, I would do documenting the whole procedure again, making sure I put in there how the patient tolerated it, and making sure that I left the patient comfortable. I would come back in about 4 hours to check on her abdomen bowel sounds again. And then I would go and do my intake and output and make sure I would total everything for my shift. And that is